you take that across.
Oh, we're getting technical now, Col.
Yeah, I know. Which for someone like me is a bit scary, so I'll just try and bring my head into this. There we go. So it's been a fascinating design project, this one. The first thing we needed to do was make sure every piece of the kit you got is functional. I mean, kit's only as strong as the weakest link, and sometimes you can get into kit because it's packaged incorrectly. Now, the nice thing about the packaging here is that it's very, very compressible, so we can actually get a lot of insulation in place inside here. But if you can really compress it, it makes it a really small piece of kit outside. But you still have to get into it. So the first thing you'll notice on this one is it's got very, very large buckles, which allow us to put a high level of compression in place. But if you're wearing large gloves or mitts, or your hands are just cold, we're not trying to thread anything through an eye of a needle. It's a very, very simple ability to get into the kit. Now, when you get into this equipment, the next thing you'll find is that it's very organized. Because there's multiple components, what you don't want, especially in a remote area where life's tough enough, everything just becomes disorganized. So you have a 1, 2, and a 3, which is the sequence. But even before we do that, and I'm sure anybody who's worked in the Arctic will profess to this, if you put anything down and you don't peg it down, you don't have it anymore because the wind takes it very quickly many miles away. And if that's your tent, the next thing happens is you're going to die because you've got no shelter. So it doesn't matter, it doesn't change with your hypothermia equipment. What we've got in this system is a couple of tent pegs held inside here. And you've also got grommet holes. So what you do is you take the tent pegs and you basically take this and you peg it into the ground. So if you're working at any wind at all, you're not going to lose your equipment. And it sounds so simple, but when you go to use it and it's blown away, it's no good to you. And that's the little things about working remote, is that level of detail that either means success or failure to what you're doing. You know yourself, Mother Nature's brutal, isn't she? If you don't actually really respect her. So respect what she can do to your kit.
Podcast the other day, it really comes down to the micro details. The equipment could slide down the glacier into a crevasse, or as you say, get blown away, and it's attention to your own kit, then yourself, then other people. And brilliant. I like it.
Yeah, and you're right, and I think you've probably nailed that. What makes a really good remote area medic? Detail.
Yeah. Detail
in the research, detail in how we pack our equipment, detail in how we function, because we're always functioning on the edge, aren't we? We're not working in perfect places. And the more detail you have specific to your requirements, the better you're going to be.
Yeah, this enables the old survive to thrive and operate and look after other people.
Yeah. And it's just, I think it's respecting their environment. If you disrespect their environment you go into, the environment will beat you up. Yeah. If you really respect it and work with it, then you're going to get some payback. But the moment you disrespect it, it'll get you. So, I think that's the thing I learned most crossing Greenland. If I switched off for a minute, it got me. It was that acute. You never could switch off. You know, I go to sleep for one night without really thinking about it, and my glove is underneath my sleeping mat. Well, I've got a frozen glove in the morning, and that's actually quite serious. It's brutal. So remote medics, detail, and design is the same as well. Yeah.
And I like the simplicity of the 1, 2, 3 stepwise process. Great for disaster management, where you're trying to bring order to the chaos.
Yeah, and you know, it's really interesting. Anybody who's seen our LinkedIn page lately, we were talking about some of the tests that we do. But one of the tests we do with our instructions is to always get a child to look at the instructions first and then apply the equipment to see if the instructions actually work. So my daughter's 10 now, so she was testing them last year as a 9-year-old. And you just watch how they function. And like the simplest things, we had to put a label on this saying this side up, because you put it on upside down. And I thought about that. And it wouldn't make too much of a difference, but it wouldn't be optimum function. So it's the detail. and it's trying to work out, why am I doing this, and why is this on here, and what's the outcome.
It's a great point. Often as medics, we're subjected to the same environment, or the same environment as the patient. So we might be hypothermic, or on the border of being hypothermic, we might be hypoglycemic, and so we're still suffering the same impacts from the environment. I think mistakes are easy to make if systems are not simple.
Yeah, and you're right, because when you're tired and you might be a bit hypo or hypoglycemic yourself, you don't do things that are difficult, do you? No. Because you're fighting against it. We can't make life easy enough for you, so that's what we're trying to do here. So, but the key to this, number one, is the insulating mat, and this is what we call the extract insulate. We keep it very small because the pattern is made on the shape of the body, so there's no spare material. Again, there's simple designs on this. When you're looking at the one-way, you're looking at the valve you blow up, we use a Boston valve, big knurly tops to it, one way, so I don't even have to replace the top, and can use any pump, and obviously we suggest you do it manual, so you don't have to carry a pump. But you don't want to use lots of breaths as well. We can get this in about 4.5 breaths. The Royal Marines said they could do it in 3, and so there's a competition if anybody can do it less. So hopefully I'll do it in 4. So we'll give it a go. Four and a half. But you can see from that, if you look at the way it's formed, we've created a pillow at the top, because patient comfort is you want something for your head to lie on, but this also allows the head naturally to lie in a bit more neutral position anyway, so we've got good patient positioning. And then what's the best insulator? Air. Air's a great insulator. So we've got very small cells to maximise the use of the air in it, but we've also got little crevices, so if a patient does bleed into it, the fluid pulls in those crevices, so they're slightly above the fluid as well. So it doesn't take it away 100%, but we're minimising it. You then put an incontinence pad on that, and you've taken away a lot of the problems through evaporation heat loss. The idea of this, I've got the extract laid out here. You can sit this in an extract. It can work independently. So immediately you've got your protection from the ground and your conduction protection. You then need a casualty. This is one I found lying around, so we'll pop them in.
Only all patients with that light.
There we go. I wish they were all this light and as easy to work with. But you can see now the patient is off the ground. Now, the next bit, and probably the bit we spent most time on, is how are we going to insulate this patient within a size criteria that's acceptable for people to carry. If we've got a full-length sleeping bag, that's fantastic. But the other problem we find with a lot of the incumbent systems is that they're almost sleeping bag designed, and you cannot get injured people inside a sleeping bag. Anybody who's treated anybody with a broken pelvis, the amount of movement we can do is so minimal. We cannot slide something up their legs. So if you're looking for functionality, it's got to be placed on the patient. So what we designed was number 2 in the system, the heat seal. Now, again, if you look at the packaging, there's loads of space in here. This just packs in like you would do a sleeping bag. It's shoved in. It doesn't have to be folded in any way. So when I pull that out, it's not difficult. Now, the clever part to this system, and it is slightly difficult to show over the web, but if you look at this line here, everything above this line has got 5 layers of insulation, so it's very thick insulation, and everything below this layer has got 2 layers of synthetic insulation. We've used synthetics more than down, so if it does get wet, it's still got a reasonable retention of heat when it's wet, because we must accept there is going to be some moisture build up, but for all sorts of reasons. But what we've done is to get the size, is that all the majority of the fibres are packed around the core. And that is I suppose, the step we've taken to not create something four season sleeping bag size, but to get it down really small. We've concentrated to keep the heat at the core.
Yeah, definitely.
Functionality wise, basically placed on, you can see what I've done here. I haven't moved my casualty, I've just placed it on them. These tuck under to get under around the kidneys. Now, what we'd also recommend is that you get some active heat around the core. That could be heat cells, that could be a hot water bottle, that could be a camelback that has got some water in it. Get it under the axilla, possibly in the groin. Anywhere we can get access to blood vessels that are close to the skin or organs, put on there. We had an interesting conversation with our medical director, Dr. John Hall, and we were talking about the core. And he said to me, you know, and I said, well, let's just place it on the top of the body. He says, why are you putting it on the rib cage? I went, well, that's the core, isn't it? He says, well, you're only going to heat muscle and bone up, so what's that going to do? Because you're not going to transfer any heat through the rib cage to where we need it.
Interesting.
We want to get it, for survivability, we want to get it into the core organs, don't we?
Yeah.
And get the blood flow. So heating up intercostal muscle and rib cage, we're not going to get much clinically from that.
It's a good point. Close to as vessels as possible.
You get it close to the vessels, you know, thinking space. If we can pack things around the abdomen, under the axilla, in the groin, that's where we're the close to the vessels on the organs. Get it around the kidneys. So we're maximising the transfer of that heat into the critical areas for survival. Because it's all about keeping core temperature, isn't it? Yeah. For survival. We can increase comfort later, but at the moment we're in survival at the moment.
Absolutely.
This is placed on a casualty. Recommended that you use whatever active heating that you've got. Simple things like it comes up over the neck here, so we stop the heat escaping from the neck. And the head's important, and there's no point putting a hood over the head because you've got to put the necks in deflection if you create a hood. We've just got a big wrap here. And remember, there's no point having insulating fibres underneath someone because they just get compressed, so you're carrying fibres for no reason at all. Little red tab here and a red tab here. All we do here is that we wrap it around the head, massive lump of Velcro here, and slap it on. So you basically wrap the head with 5 layers of insulation, clip it together, adjust. Probably one of my favourite design parts of this is if you now look at the head, anybody who's been outdoors knows that's in a good place now.
Absolutely. Yeah.
But you can do it with big gloves. There's no fine motor skills required. With this, because they're in an extract, it can work independently. Extract just pulls it all together. It's extra long, so we can wrap the feet from a pure comfort point of view, to be honest. We just pull it together. Remember, we talked about reducing the extract. This is the reduction cord that we have. Now, it's also important that we minimise the compression of the fibres, because remember, we want air in the fibres to maximise it. So extract is pretty good at not compressing fibres, which is good. So now what you can see is that we're creating a microclimate inside here. So we've got protection underneath, under here, we've got good air insulation here. We're minimising the space that anything can get in. But the majority of the insulation is from here to here. So if I flip this chap over, you can imagine yourself out on an expedition now or doing a rescue. This is probably a better scenario for your casualty than some of the incumbents at the moment. There's one more bit to go on it if you've got inclement weather, but what we can do from a patient access point of view is I can still get into my patient. I'm not having to take anything off to do that. So it's still minimum exposure to get quite good access in. If I do have to take it off, it's very quick to put back on again. I don't have to slide off like a sleeping bag to get back in again.
That's a really good point when we talk about prolonged evacuation, prolonged field care, where the requirement to constantly monitor interventions and vital signs and look for trends and respond to those changes. I think it's fantastic. You can get access from top to toe.
Absolutely. And the other thing, I mean, we've trialled this about -2, -4. If you're working in a more Arctic environment, then you just pack some more fibres on. So if there's a spare jacket in the team, focus it on the core.
Right.
You know, so you can complement it depending on the climate that you want. So this I would think is good for sort of cold temperate. If you would go more Arctic, you know, as you would a sleeping bag, you would take a bigger bag. So you should complement it with more fibres depending on the environment that you're working in. The last stage, number 3, which is a relevant protection sheet. You know, convection heat loss is huge in our environments. And all this is a very big rucksack cover. It goes over the top of the extract. And then it's elasticated around the bottom. So, if you look down what you've got, is you've got, the key to this, it doesn't have to be very thick and it doesn't have to be hugely technical fabric, because it's loose and it will shed, because you know yourself when you wear your waterproofs, the moisture wicks in at the tight areas. So we kept this very loose. So if it's spin drift or snow or rain, it will just wick it off really easy.
Absolutely fantastic. So we've got the conduction, the conductive heat loss mitigated through the inflatable mattress. Then we've got the insulation added with a breathable, waterproof, windproof core or exterior. Sorry, that's absolutely fantastic. So you're covering conduction, evaporation, radiation, and convection all in one. And
comfort as well, which is always good. Accessibility, you've got access to the chest with a flap here, and you've got also 2 ways that, so I only have to open little bits to get into them as well. So it's all elasticated, I can get as well. But the secret is that we got it to that size. So it's as acceptable as we can make it from a size and weight point of view. You know, with good clinical results. Obviously, size and weight always have some level of compromise, but we think we've got that compromise just about right to give you a very functional system. I'll whiz back to the seat, and if that's okay.
Yeah, get comfortable and get the coffee on.
Yeah. So yeah, that's our heat saver.